bit about your findings and tell me if there was anything that you thought was either surprising or stuck out to you or may have been a little bit out of the normal.
I'll start by saying, I think that for the physicians in the cities that were first hit in the pandemic, there was like this big push to share as much medical knowledge about COVID as we possibly could to help other cities prepare. But what I wasn't seeing so much of was sharing what we were experiencing as the people behind the medical providers, and how that was affecting us and the ways in which we were dealing with it. So I sort of wanted to send this survey out to understand, exactly how people were being affected by this and how severe it was so that I could share that information with other departments around the country in the hopes that it would help them prepare. So I basically wanted to look at fear, anxiety, and depression. Those were words that were popping up all the time in the hospital for us as neurologists and as doctors and residents. And I thought it was really important to try and just get a sense of how many of us were really feeling that burden. And so I surveyed, both faculty and residents in the department. And overall, everyone sort of reported increased fear, increased anxiety, and depression. So for fear and anxiety, it was 79 and 83% of my respondents, said, this is something I'm dealing with here, which is a huge number. And for depression, 38% of people kind of copped to feeling like they might be struggling with depression as a result of the pandemic. And what was most interesting to me about that is that there was no significant difference between the resident responders and the faculty responders. So I thought that I might see a little bit of a difference on the resident level because we were more likely to be on the front line, actually seeing the consults in the ER or, working as primary providers in the COVID units themselves. But really, there was no significant difference in the amount of fear, anxiety, and depression that both groups reported. So that was just said to me, we're all in this together. We're all feeling it in our own ways. And I think that was hugely interesting.
So talk to me a little bit about your personal experience. Was there, obviously everybody's experience for COVID kind of differs, depending on what level you're at or how much exposure you have to it. So talk to me a little bit about your experience and some of the takeaways that you've had from just COVID and the COVID pandemic in general.
So for me personally, I'm a resident again, and the role that I took on personally in the pandemic was to head to the COVID ICUs. And so I spent a couple of months actually working as a doctor in the COVID ICUs. I took my neurology hat off and became, a medical intensivist temporarily. And that was, hugely intimidating for me. It was not my normal field. These patients were super sick, and they were sick in a way that we didn't know what to expect would happen next. And we didn't know what the best thing to do for these patients was. So the combination of having this big unknown disease process and being out of my sort of comfort zone as a neurologist was, so anxiety provoking. I also had a lot of fear around getting COVID, and I ultimately did get COVID. And so that was another sort of set of fears about how that would affect me. I saw patients get so sick. I was worried for myself. I was worried about spreading it to my friends and family and my colleagues. And, for me, I did feel a lot of sadness and shock at the amount of death and tragedy that, we were seeing. Of course, as doctors, we know to expect that patients will have bad outcomes, unfortunately, even if we do the best we can possibly do for them as their physician. But to see the amount of death on the scales that we did in this COVID pandemic was beyond words in terms of describing how that affected each of us individually. But I think one thing I really like about your question is that you hit the nail right on the head. For every single person, it was an individual experience as to how this pandemic really affected them. So, for me, that was my personal experience. For somebody else, they may have been, at home having to take care of kids and be a homeschool teacher, and then also see 20 patients on televisits a day and deal with all the challenges that come with that. which is also very stressful and anxiety provoking in its own way, right? And that's just one example that I can think of off the top of my head of, you know, how pervasive the effects of this pandemic really were for every single member in our department.